so the first thing you're going to do for anterior flexion mobs to help improve the bending and loosen up the nervous system in the spine, you're going to grab underneath their knees, hook both of their knees together, and support them. I've got her close to my body. I'm supporting her. I take my fingers. You can take 2 fingers like this. You can take kind of a knuckle and make a pinch like that. Or you can just do 2 fingers. I usually do 2 fingers. You find the belly button. You go to the outside of the belly button about 1 inch to 2 inches. And you drop down about 1 inch so that you're down at the lower part of the back, around L5. And then you press down into their belly button. You're going to feel kind of a firm surface. That's their spine underneath that. You're going to bend the knees up towards the chest. You're going to kind of feel things wiggle underneath you. You're feeling the spine moving like this underneath your fingers. So fingers a couple inches below the belly button, 1 inch to 2 inches below the belly button, and 1 inch to 1.5 inches to the outside of the belly button. And then you're just bending their knees up towards their chest, just rocking. And you're going to do that for a minute or 2. So you'd continue to do this. And then I'm going to move my finger up 1 level. So about 1/2 inch, I move my finger up. And then I bend. I do that for a couple of minutes. And then I go up 1 more level, about 1/2 inch, another 1/2 inch up, and I bend. And I do that for a couple minutes. And you keep doing it until 1, it becomes less uncomfortable for the patient. 2, you feel it start to loosen up and the firmness starts to kind of go away. And you're going to do this on both sides. So you do it on, right now I'm on her left side. I'm going to come around the table and I'm going to do it on the opposite side. And then after you've done it on both sides, so we've bent her here, and let's say I came around the table and I bent her up and I did the other side, then you're going to bring her knees to her chest and ask her to hold her knees towards your chest using her tummy muscles. Be very careful that the hip flexor is not working, okay? And I'm going to ask her to hold there. And she's kind of struggling to hold that. And I'm just going to barely give any resistance. Not a whole lot, just enough to give her a little resistance in her abs. She's going to start to shake for a little while. After a while, she'll go through the shakes, and then she'll start to get really solid with her abs. You're going to hold this tightness, or this little bit of resistance, for 60 to 90 seconds. And after she goes through the shakes, it's going to become real solid. So I'm not going to maintain that, but after a while, she'll start to get real solid. So 60 to 90 seconds. And that's the anterior flexion mode to help calm down her nervous system, loosen up the legs and the hip flexors and kind of just relax all the muscles, and to try to get her bending better in her spine so that she can get her core going a little bit better.